Hey everybody, Dr. Rafich here, Vet Triage. We are continuing on with a New Year's Eve edition. Same JAVMA article, February 15, 2017. Happy New Year. Here comes 2025. I can't believe it. Okay, and then the paper that we're working on here is the effect of anesthesia-associated hypotension on neurologic outcome in dogs undergoing hemilaminectomy because of acute severe thoracolumbar intervertebral disc herniations. 56 cases, 2007 to 2013. This comes out of Purdue University Vet School and the Vet School Washington State, as well as the Charlotte Animal Referral and Emergency. So right off the bat, from 2007 to 2013, 56 cases. If you're a high-end, high-volume, multi-specialty hospital that performs neurosurgery like this, 56 sounds like a very low number. It's a low caseload. So that's a criticism right off the bat. But let's get into it. The objective is to evaluate the effect of anesthesia-associated hypotension on final motor and urinary function in paraplegic dogs without nociception that underwent hemilaminectomy because of acute severe thoracolumbar intervertebral disc herniation. So a few things to go over just right there on the objective for those who don't know. First off, on the bottom here on the screen, you can see my YouTube channel that I talk about spine surgery in dogs, so feel free to look into that. There's actually several parts of it, from the discussion with the surgeon to the surgery to post-operative recovery. So that's number one. Number two, anesthesia-associated hypotension. Hypotension means low blood pressure on final motor and urinary function. So we want to know, can these dogs urinate on their own? Are they consciously aware? They have full control over the urination? And then motor abilities, can they walk? Can they ambulate? In general, as a rule, you can't have the ability to walk without the ability to feel. And so usually if you are paralyzed from a disc herniation or a tumor or trauma or whatever it is, and let's say you have no feeling, no movement in your legs, you're paraplegic. Well, you go from paraplegic, which is just limp limbs, to having nociception, which is the perception of pain, to then motor function, which is the ability to move the legs, then ambulate, so actually walk on those legs, and the final stage is gaining your general proprioceptive, which is the ability to balance, to know where your legs are in space, and that's what gets you to walk from to go from a ataxic ambulation, so wobbly, kind of drunk, dizzy walking, to normal walking. It always follows that scale. The spinal cord deteriorates in reverse order, and it gets better in the reverse order. 56 animals, retrospective study. They looked at these animals at least 4 weeks after surgery. They assessed motor function based on a 5-point scale. They based urinary function on a 3-point scale. Hypotension was defined as a mean arterial pressure of 60 millimeters of mercury or less, or a systolic arterial pressure of less than 80 millimeters of mercury for at least 2 consecutive readings, 5 minutes apart. Results: 59% experienced hypotension during anesthesia, 61% gained ambulation after surgery. Whether dogs regained motor or urinary function was not significantly associated with the occurrence of hypotension, the duration of hypotension, or the lowest blood pressure recorded. So let's get into it. Introduction. Anesthetic agents may cause decreased vascular resistance as a result of vasodilation and reduced cardiac contractility, which leads to decreased systemic arterial pressure. So vascular resistance is the smaller the blood vessels, the higher the resistance, right? Trying to rush water through a narrow tube is going to experience more resistance than rushing water through a larger tube. And then vasodilation is dilated vessels, reduced cardiac contractility. So what is the ability of the heart to contract? How strong is the contraction? Systemic hypotension can then decrease perfusion to various organs like kidneys and brain, decrease coronary artery perfusion, increased bacterial translocation from the gastrointestinal tract, impaired hepatic function, and activation of the coagulation cascade. So the bacterial translocation from the GI tract is important. Vet students need to know that if you have an animal that's in shock, meaning it's got a decreased circulatory capacity, then the bacteria blood flow to the gastrointestinal tract is lessened, and that creates an issue with immunological barriers, functionality, protecting the body from whatever's in the GI tract, which is bacteria. And then those bacteria say, hey, gates are wide open, and they get into the bloodstream. That's how you can go from being in shock to being in sepsis. The reported incidence of anesthesia-associated hypotension in small animals is between 7% and 74%. Okay, that's a wide range. Under normal physiologic conditions, autoregulation maintains spinal cord perfusion despite wide fluctuations in mean arterial pressure, as has been demonstrated in multiple mammalian species, sheep, rat, cats, dogs. However, following injury, autoregulation may no longer be effective, potentially resulting in severely decreased spinal cord blood flow. Neurogenic shock is a type of distributive shock affecting patients with spinal cord injuries that is characterized by prolonged and persistent hypotension. Acute spinal cord injury has two phases, primary and secondary. Primary is a disc herniation. Secondary, or whatever trauma caused the spinal cord issue. Secondary injury occurs when spinal cord ischemia, meaning loss of blood flow, leads to activation of inflammatory pathways, cytokines, inflammatory cells, oxygen radical species, fluctuations in ion concentrations that continue to damage the spinal cord for up to 1 week after the primary injury occurs. Systemic hypotension after spinal cord injury can worsen spinal cord ischemia and cause secondary injury to worsen. Materials and methods. Absence of nociception prior to surgery, as assessed by pinching the digits of the hind limbs. Nociception absent for 24 hours or less. A diagnosis of thoracolumbar disc disease by CT or MRI, and no other spinal cord abnormalities noted. A diagnosis of Hansen 1, type 1 thoracolumbar, confirmed in surgery. Treatment of disc disease by hemilaminectomy. Complete anesthetic and surgical records available, and at least 4 weeks follow-up. Let's get into that real quick. So the ability to assess nociception, which is the ability of the animals to feel pain, they pinch the limbs. I'm going to argue that there could be some patients where pinching the limbs was not enough, and you should assess them with other ways as well. And also, I would also argue that if any of these animals had narcotics, analgesia, whatever, before this was assessed, that could numb their ability to have nociception, which could make some animals seem like they don't have any, but they actually do. So as a general rule, if you're going to actually assess nociception, motor function, urinary function in these dogs, you have to make sure they don't get any pain medication. And for how long? I mean, most pain medications last, a few hours. Some can last 6 hours, 12 hours, 24 hours. So if you're going to do an accurate neurologic assessment, you have to withhold pain meds. And the problem with that, of course, is it becomes a little bit unethical because you have disc herniation, it's painful spine. So I'm going to argue that because they didn't have that as a criteria here, that these animals received no analgesia beforehand, and the only test for nociception was pinching the toes, there may be a false population of animals here. I'm also going to say that they use CT or MRI. MRI is better, hands down, in all regards for spinal cord disease. And CT has its place, especially if you don't have MRI. And I imagine that out of the 3 facilities, at least one of them don't have an MRI, and so they had to use CT scan. But I'm going to argue there's a possibility of inaccurate diagnoses based on the imaging as well. Okay, materials and methods. For patients that did not return to the hospital within the first 4 weeks, referring veterinarians and owners were contacted by phone to get follow-up. That again is another problem because now you're relying on either the owners or the family veterinarian to tell you whether or not these dogs have nociception, motor function, urinary function, and that's just not accurate because everybody's interpretation of this stuff is different since it's a subjective measurement. So, no bueno. The severity of hypotension was classified as moderate or severe on the basis of the lowest blood pressure recorded, with moderate being a mean arterial pressure of 50 to 60 millimeters of mercury, or systolic of 70 to 80. Severe is less than 50 for mean and less than 70 for systolic. Mild duration of hypotension, 10 to 15 minute period of time, 2 or 3 consecutive readings, or less than 30 minutes of hypotension in total during the anesthetic period. Moderate was defined as 15 to 25 minute period of hypotension, so 3 to 5 readings, or 30 to less than 60 minutes of hypotension, and severe defined as over 25 minutes of low blood pressure, over 5 consecutive readings, or over 60 minutes. Motor function was graded on a previously described canine spinal cord injury scale. Grade 1 was defined as ambulatory Grade 2 was defined as non-ambulatory paraparesis with movement of at least one joint. Grade 3 was defined as non-ambulatory paraparesis with movement of only the hip joint. 4 was non-ambulatory paraplegia with nociception, and then 5 was defined as paraplegia without nociception. Urinary function was graded on a 3-point scale. 1 was normal. 2 is defined as the ability to begin urination voluntarily but without completely voiding the bladder, or the inability to begin urination but with the ability to maintain a urine stream. And then 3 was complete urinary incontinence. This video is sponsored by Monster. I wish. Monster, call me. Results: 31 spayed females, mostly dachshunds, median age 4.8 years, median weight 7.3 kilograms or 16.1 pounds. Median duration of clinical signs prior to initial examination was 48 hours. Another problem: the range was 3 to 480 hours. We know that the duration of spinal cord injury, especially over 48 hours, can ruin the prognosis. So it's a shame they didn't limit this study to dogs that had clinical signs within only 48 hours. They describe, I feel like I'm tearing this paper apart, but this is my specialty, and there's lots of holes here, but I'm surprised. JAVMA, come on. So, and they're also describing these dogs having acute disc herniation. Well, you're telling me 480 hours? I don't know if it's considered acute anymore. Acute typically for a lot of us, histopathologically speaking, it's less than 7 days. It's considered acute. Over 7 days, it's considered chronic. But in terms of disc herniation, I don't know, man. 48 hours seems like the max to me. Anyway, premedication includes acepromazine, hydromorphone, dexmedetomidine, or some combination. Some did not receive premedication. Then they got propofol or ketamine or butorphanol, then general anesthesia with isoflurane, oxygen, endotracheal intubation. Median duration of anesthesia was 192 minutes. They didn't say how long surgery was. They just said anesthesia is 192 minutes. I'd be interested to know how long the surgery was. 59% of dogs developed hypotension, and hypotension was treated by either decreasing the isoflurane, giving vasopressors, giving IV crystalloids, or IV colloids, or a combination. Incidence of hypotension was not significantly different between dogs that received acepromazine and those that not. Finer motor and urinary grades were not significantly different between dogs that had hypotension treated by decreasing the gas, administering vasopressors, or giving IV crystalloids, and in those dogs where none were administered. Final motor function grade was not significantly associated with whether dogs had developed hypotension. All dogs had complete urinary incontinence prior to going into surgery. Again, it could be affected by analgesia given before surgery, so I don't know how accurate that's going to be. Final urinary grade was not significantly associated with hypotension. Duration of hypotension was not associated with motor function grade, urinary grade. Similarity, severity of hypotension was not associated with motor or urinary grade. 9% of dogs were euthanized after surgery because of suspected myelomalacia, and that was defined as having at least 2 of the following signs: ascending cutaneous trunci reflex, lower motor neuron signs of the pelvic limbs and anus, tetraparesis, hypoventilation, respiratory disease. No necropsies were performed to document that, which again is going to be unfortunately another weakness of the paper. Discussion. 73% of dogs in the present study recovered some motor function. 61% were ambulatory, so grade 1, within 4 weeks after surgery. Previous studies of dogs with disc disease and absent nociception have a 41 to 69% recovery rate, meaning they can ambulate. This is consistent with this study. Another study showed that 87 dogs with absent nociception returned to ambulation, required a mean of 7.5 weeks. However, 62% were ambulatory within 4 weeks. So the idea here is that some of these dogs may have recovered motor function beyond the 4 weeks, but the study cut off at 4 weeks, which again is another weakness of the paper. 9% of dogs in the present study were euthanized after surgery because of myelomalacia. Previous studies report that suspecting ascending or descending myelomalacia occurring postoperatively in 3.5 to 11% of dogs with disc disease and absent nociception before surgery. Ascending, descending myelomalacia. So ascending means it's going from the site of the injury cranially, so towards the head. Descending means site of injury down to the tail. Myelomalacia, myelo means spinal cord, malacia means softening of. So this is believed to be due to secondary changes that we described earlier of ischemia, oxygen radicals, cytokines, inflammatory cells. And because even though you remove the source of the spinal cord injury, the cascade of events that occurs from the secondary injury of spinal cord trauma continue to progress anyway. And if it continues to progress in an unmanaged fashion, spinal cord literally begins to die. And if it ascends, you start seeing signs of inability to feel the skin, can't control breathing, and then you die from that. And descending means that you start losing tone in the hind legs, tone to the tail, tone to the anus, can't feel the skin. So it's a grave prognosis, especially with ascending. Ascending is the worst because it ends up affecting the spinal cord at the level of the phrenic nerves, which control the diaphragm. All right, let's go on. Let's see. The percentage of patients that experienced hypotension in this study was 59%, similar to other studies, which range of 77 to 74%. Persistent hypotension for up to 5 hours can be seen following severe injury to the spinal cord in several mammalian species. This is referred to as neurogenic shock. It's been clinically reported in people with acute spinal cord injury, but we're not aware of any dog reports. Previous reports show it's important to maintain normal tension in dogs with acute spinal cord injury or disc disease to improve clinical outcome. However, hypotension in any patient undergoing anesthesia should be addressed regardless, and for the sake of the other organs. There's only been one previous report that found a significant effect of perioperative hypotension during neurosurgery on development of postoperative complications. Results of that report indicate that 12% of patients undergoing a ventral slot procedure for cervical disc disease experienced hypotension during anesthesia, and that these dogs were 23 times as likely to develop complications, including intraoperative bleeding, worsening pain after surgery, worsening neurologic function after surgery, and aspiration pneumonia. And I do have a video on my channel, my YouTube channel, for ventral slots for those who are interested. Dogs experiencing complications were significantly more likely to have poor outcome. Long-term motor and urine function was not evaluated in that study. One of the contributing factors to spinal cord ischemia is loss of spinal cord autoregulatory capacity. Blood flow is dependent on multiple factors. Most important is mean arterial pressure and systemic vascular resistance. After injury, spinal cord autoregulatory capacity is lost. Blood flow is then directly affected by the mean arterial pressure. The American Association of Neurologic Surgeons in 2013 had treatment guidelines for human patients with acute spinal cord injury, recommending to maintain mean arterial pressure in the upper range of normal tension, which is 85 to 90 millimeters of mercury, for the first 7 days after injury. However, there's been no studies otherwise examining that because of the unethical implications. So isn't that interesting? They make recommendations in human medicine without having validation, and so do we in veterinary medicine, yet we're criticized all the time for it. Multiple studies in animals and humans have demonstrated that decreased spinal cord perfusion and ischemia begins within minutes to hours after severe spinal cord injury. In experimental studies of spinal cord injury in animals, spinal cord blood flow and tissue oxygenation decreased within 1 hour after injury, remained persistent over the first 4 hours after injury in both white and gray matter. Spinal cord hemorrhage occurred in the first 15 minutes after injury. Edema necrosis, especially if the gray matter and central white matter, developed within the first 2 hours after injury. By 5 hours, edema necrosis was in the white matter. Another study suggested that if treatments to improve spinal cord flow after injury could be implemented within the first 3 to 4 hours, it may improve outcome. In experimental studies, spinal cord ischemia in animals, it has been reported that the longer the duration of ischemia, the more severe the secondary injury and the worsening of the neurologic outcome. And again, some of these dogs had up to 480 hours worth of disease before they got cut, so it's just bad. In mice, when spinal cord ischemia was induced by cross-clamping the aorta for 9 minutes, motor function was recovered within 48 hours. However, when you have it for 11 minutes, 80% of those mice are paralyzed, and hemorrhage and edema was more severe. The authors of another study reported that when hypertension was artificially maintained during spinal cord ischemia in rats, neurologic outcome was better. All right, let's see if I went over all the issues with this paper. Yeah, no, that's pretty much it. So, overall, not a strong paper, honestly. And, it's good to assess whether or not hypotension during anesthesia does affect spinal cord perfusion, because we do try and promote that, and we talked to pet owners about that. So it'd be nice to know if that was true or not. But I would want to see more papers, especially more accurate ones, because this one did not do it for me. Sorry. All right, guys. It's Tuesday, December 31st. Happy New Year's again. 10:32 a.m. Pacific time. I'm going to try to be on tomorrow, which will be January 1st, 2025. Happy New Year, and we'll see you guys then. Bye.